Good morning, students. Today we can see the remaining portions of documentation, that means type of records, common record keeping forms and method of recording. Types. The first one is type of record. First one is the outpatient and inpatient records. Outpatient record is filled by the outpatient department. Then inpatient record will be continuation of the patient record. This will contain the biodata of the client, diagnosis, family history, history of present and past illness, findings of the medical examinations, investigations, treatments, medications, progress notes, summary made by at the discharge of the client. Second is nurses record. Large part of the client's record are filed by the nurses. Nurses Notes are a record of treatments and nursing measures carried out by the nurses. Their effects, their observations are made on the client. Avoid bulky report containing unnecessary and irrelevant materials. Third is doctor's order sheet. The doctor's orders are regarding the medications, investigation, diet, etc. may be written on a separate sheet. Then TPA charts on the temperature, pulse, respirations are written on a graphic form so that slight deviations from the normal can be noted at a glance. Reports on laboratory examination, diet, because all the results of the laboratory examination sometimes may be stick on one particular paper, so it may be known as the report on the laboratory examination. Diet chart, if the patient has to be follow some particular diet, for example, diabetic diet, it has to be recorded. And consent form, the operations and anesthesia. Then intake output chart, clients on intravenous fluid or on a fluid diet, critically ill patients, post-operative patients, clients with edema, having vomiting and diarrhea, clients getting diuretics, etc. should have their intake and output maintained. Then reports of anesthesia, physiotherapy or other special treatment which is going on in the hospital. Medication record, it consists of a designated area to be recorded, name and dose of the drug, date and time of administration, route and frequency of administration, her signature and any drug allergy. Discharge or refusal summaries. This is made on discharge of the patient client or at the time of transfer of the client to another healthcare institution. Registers. To maintain the statistics, every hospital maintains certain registers such as birth, death registers, registers for operations, deliveries, census, admission, discharge, OPD attendance, etc. It is the nurse's responsibility to maintain these registers up to date. Medical legal cases. The important document maintained by the hospital in medical legal cases and road traffic accident cases are as follows. First one is police intimation. This has to be given to the nearest police station by the hospital. Wound certificate. These are given to the request by the police. It must be duly signed by the medical officers. Discharge certificate. This is given on demand from the police for the medical legal case and road traffic accident cases. Common record keeping forms. First one is admission, nursing history forms. A nursing history form completed by the client is admitted to a nursing care unit. Data on the history forms provide the baseline data can be compared with the changes in the client condition. Each institution designs a nursing history form differently based on the standards of practice and philosophy of nursing care. Second is flow sheet and graphic record. Flow sheets are forms that allow nurses to quickly and easily enter the assessment data about the patient, including vital signs, routine repetitive cases, hygiene measures, ambulations, meals, weight, height, safety and restraint care, etc. It also provides quick and easy reference for the healthcare team members in assessing client status. The benefits of using flowsheet are information accessible to all members of the health team, time spent on writing narrations, notice disease. Information is current, errors resulting from transfer of information are decreased, and team members can quickly see the trends over the time. Activity records. Activity records provide the method of determining the hours of care and staff required for a given group of client. Client acuity level is based on the type of number of nursing interventions required for providing care for 24 hours. For example, acuity system might rate bathing the client from 1 to 5. 1 is totally dependent patient and 5 is independent patient, one who can take bath by himself. Cardex or client care summary. Cardex is widely used concise method of organizing and recording about a client, making information quickly accessible to all health professionals. This system consists of series of cards kept in a portable index file or in a computer-generated forms. This card for a particular patient can quickly access to reveal specific data. Information on Cardex may be organized and Sections like list of fluids, list of medications, information about client allergies, list of diagnostic procedures, etc. It is important to have place on record date and initials of a person who review or revise it. Standardized care plan. The plans based on the institution's standards of nursing practice are pre-printed, established guidelines that are used to care for the clients who have similar health problems. After a nursing assessment is completed, the staff nurse identifies the standard care plans that are appropriate for the client. One advantage of standardized care plan is establishment of clinically sound standards for care for similar group of patients. Another advantage of care plan is education. It also improves continuity of nursing care among the professional nurses. Discharge summary forms. Much emphasis placed on preparing the client for effective, timely discharge from the healthcare institution. Multidisciplinary involvement. Multidisciplinary means many teams, that is physicians, physiotherapists, nurses, all comes as a multidisciplinary involvement in discharge planning helps to ensure that the client leaves the hospital in a timely manner with necessary resources. Discharge and referral summaries include description of client's physical, mental, emotional status and discharge or transfer, resolved health problems, unresolved or continued health problems like wound care, oxygen therapy, current medications, restrictions that relate to access, lifting, stair climbing, walking, resuming work, etc. Comfort levels, supporting networks including family, community, self-help groups, home care and community agencies available. Client education including follow-up appointments, discharge destinations, that means to home nursing home, and mode of discharge in walking, wheelchair or ambulance, and referral services like social worker, home health nurse, etc. Methods of recording. There are several documentation systems for recording the client data. First one, narrative documentation. It is a traditional method of recording nursing care. It is simply used story-like format to document information specific to a client conditions and nursing care. Second is problem-oriented medical record. Otherwise, in short, we can call it as a POMR, problem-oriented medical record. It is a method of documentation that places emphasis on the client problem. Data are organized by problem or diagnosis. Each member of the healthcare team contributes to a single list of identified health problems. POMR have the following major sections. They are: first is database. They contain all available assessment information pertaining to the client. It is the foundation for identifying client problems and planning care. Second, problem list. After data analysis, the problems are identified and a single list is made. The problems are arranged in chronological order and filed in the front of the patient's record to serve as an organizing guide for the client care. New problems are added as they identify. When the problem has been resolved, the date recorded and it is highlighted, or a line is drawn to the problem and its numbers. The third one is nursing care plan. A care plan is based on each problem by the discipline involved in nursing care. And fourth one is progress note. A healthcare team members monitor and record progress note of the healthcare client problem. The information can be expressed in various formal structured notes. The SOP chart. So S means subjective data, O means subjective data, A means assessment, P means plan. So I means and added, so I means interventions and E means evaluation. So the logic of SOP not similar to that of nursing process. Second method of PIE format is it differs from SOP because it does not contain assessment information. So it includes problem, interventions and evaluations. PIE notes are numbered or labeled according to the client problems. To solve problems are dropped from the daily documentation after the nurse review. Continuing problems are documented daily. Third method is focus charting. It involves DAR not. D means data, A means action or nursing intervention, R means response of the client. In focus charting, we can include any client concern, a sign or symptom, a condition, a diagnosis, a behavior, a significant event, etc. Focus charting is easily understood by caregivers and adaptable to the most healthcare setting. Source record. Source record is the client card. Client chart is organized so that each discipline like nursing, medicine, therapy, etc. have separate section which record data. One advantage is that caregivers can easily locate the proper section of the record in which to make entries. Disadvantage of source record is that details about specific problem may be distributed throughout the record. General documentation guidelines. First, ensure that you have correct client record or chart. That means don't take the chart depending upon the room number. Sometimes in a room there may be two patients and accidentally you may take the other. You want to record of the one person, you may be accidentally entering the other person's record. Documentation as soon as the client encounter concluded to accurate record the data, because once we have done the procedure or an assessment, come immediately wash your hands, then write the record, because as the time goes you may forget some of the relevant data. Date and time of each entry. Sign each entry with your full legal name and with your professional credentials like registered nurse. Do not leave any space in between the entries. If the error is made while documenting, use a single line to cross the error, then date and time sign the correction. Never change other person's entry even if it is incorrect. So don't attempt other person is corrected. If something ended wrongly, ask that person to come and do it. Correction. Use quotation marks to indicate direct current responsiveness. Document chronological order. Use permanent ink. Document all telephone calls that you receive related to the client case. Minimize legal liability to the effective record keeping. So we have to keep date and time, legibility, permanence, correct spelling, signature, accuracy, sequence, appropriateness, completeness, conciseness, accepted terminology in 24-hour time or 12-hour time in which the hospital follows. So correcting errors, that means if you have unknowingly you have entered some wrong data, then what to do? If you spill something on the chart, do not discard the note. Recopy. Put the original and copy sheet in the chart. Record copy. Do not scribble out the chart. Avoid using error or wrong patient when making corrections. Follow your facility policy or the hospital policy. Do not alter charting. It is a legal document. Correct errors by drawing a single horizontal line through the error. Write the word error above the line and then sign your signature. No ink eradication, like don't use any white ink above the mistake. Ensure or use of occlusive materials. Thank you for listening.